Hello, I'm Ed Pruitt, Editorial Director of NEJM Catalyst, and I'm pleased to be here today with Dr. Patrick Conway, CEO of Optum. Welcome, Patrick.
Thanks, Ed. It's great to be here.
So, Patrick, you are the fairly new CEO of Optum. You took the position last May. You've had a number of other roles with Optum, but new as the overall CEO. And it's been a period of intense scrutiny, to say the least, for Optum's parent company, United Health Group. What's the job been like for you for the first few months? And I would also add, how is Optum changing?
Thanks for the question. Very busy the first few months. We have a great team, but lots of work to do. I always like to center us on the mission. So the mission of Optum is to help people live healthier lives and to help make the health system better for everyone. We serve north of 125 million people in various ways across the country. And we take that mission very seriously. How do we do that day in and day out in our various areas, which I'll briefly touch on. And then I think secondly, and hopefully you see this, we're trying to deeply engage with stakeholders across the system and really doing that proactively. So whether it's with government or other private organizations, how do we partner? How do we really help shape the system? How do we work with people to drive better health outcomes in the system? And then just to briefly touch on the various components of Optum to make sure people get the high level. In Optum Health, it's all about value-based care. So how do you deliver value-based care at scale to people in clinics and homes, mental and behavioral? How do you serve their various healthcare needs? How do you do that holistically, whether they be dual eligibles, Medicare, commercial insurance, or Medicaid? And there, we're doing a lot of work to standardize that model, to really invest in the clinical model to drive the outcomes we want. And you'll see us continue to do that. And then next, Optum Rx, I'd call out, we're trying to shift the model, and I'll give you a few examples. We had announced 100% commercial rebate pass-through. So passing on those rebates, those discounts that we negotiate on our clients' behalf. By the way, saving on average $2,000 per person per year, and passing those on to the employers, to the payers, to the consumers of healthcare. Next, we did cost-based reimbursement. So you may have heard from independent pharmacies and others the challenges where they lose money on some drugs and may make money on other drugs. In cost-based reimbursement, the goal is to provide access, to create incentives for pharmacies, including independent pharmacies, to dispense all drugs. And then the third area I'd call out in Optum Rx is, and this is true across Optum, but just an RX example, we removed about 25% of reauthorizations. That's over 10% of total prior authorizations. So we just said, these aren't necessary anymore. We're reducing friction in the system based on the clinical evidence, and also, doing work just to make the system simpler, easier to navigate for people. And then last but not least, we have a business that's Optum Insight and Optum Financial. Think of that as the tech, the AI, the services, and the financial services that benefit payers, employers, and consumers. We're investing in AI, which I think we'll talk about today, and, examples that I think we'll dive deeper into. How do we make prior authorization simpler? How do we make it easier? How do we make it faster? So I'm excited about the opportunity. We've got a great team, certainly challenging times, but the core of what we're trying to do, serve people's physical, mental, pharmacy, social, and financial needs is as you know, critical to the U.S. health system.
Well, thanks for that. So it sounds like you're doubling down on the mission. These are things that Optum has been working on in the past. Is Optum changing anything in response to the current, say, political environment? And what are your top three strategic priorities for the next 5 years? You mentioned value-based care and AI.
Yeah. Yeah, so we're certainly engaging, both in the political environment, but just broadly with regulators, legislators, various folks in the healthcare ecosystem. I call out three priorities. One is value-based care, and as you know, I like to use data and anecdote. So in Optum Health, how do you deliver comprehensive care including in the home, which we've talked about before. There, when you look at our results, hospitalizations do go down on a population level in our value-based care arrangements. The quality and experience are high, so think 4-star plus positive experiences. For example, our Optum at Home model, which is caring for full risk care for dual eligibles in the home, as NPS, Net Promoter Score results in the 80s and 90s, similar for many of our models. And the story I'd share there is a 90 plus year old woman in the home that we care for her, and she's got multiple chronic conditions, low income, and we decreased her hospitalizations from almost 10 times in the previous year to 0. When she had mental health needs, we addressed those. When she had social needs, she needed her home modified or food insecurity addressed. We addressed those needs. So that's really value-based care. And now, how do we standardize that and really scale it across the country? The next I'd call out is consumer experiences. And the experience of healthcare. So we're making major investments in AI, digital, et cetera, for consumer experiences. There I'd call out, I sort of go to the front line to learn. So I was with our digital team the other day, and they were showing me, how easy it is to order a medicine, get home delivery, know when it's going to be delivered. They also showed me examples in the prior auth arena where, on the app, the member, the patient, can check and know what's happening, or the provider. So really investing in consumer and digital experiences. Then the third area I'd call out is enabling health systems to function better. So we serve the vast majority of payers and providers across the country in some way. So how do we help them succeed? So think of health systems where we may help them with revenue cycle management, or supporting their clinical care teams, or payers where we may support them in various aspects of how they operationalize their payer system. So we are often supporting others, payers, employers, providers in the system, and delivering the benefits and the care to their members and employees. So those are the areas I'd call out.
Very good. So you have really unusual breadth of leadership and healthcare organizations. You've led government organization, large payer, and now one of the largest, maybe the largest healthcare services company in the world. Across these roles, how has your view of the healthcare ecosystem evolved?
Yeah, so it's interesting. I actually had somebody last night say to me, "You've kind of been the same person for the last 25 years I've known you." I was like, I think I'll take that as a compliment. Um, uh, Look, it is all the same set of issues. I'm a practicing physician, as you said, led and provide organizations, for example, Cincinnati Children's, CEO of a Blue Cross plan in North Carolina, been in government twice, including, the last time running the CMS Innovation Center and ultimately leading CMS, and now at Optum. And the goal has been the same. How do you make the health system better for people? How do you do that at scale? How do you work on that each and every day? And so, tangibly, when you're at CMS, you're writing regulations and the rules and the incentives, but for that same goal. And I used to say, with a stroke of a pen, you could have a major impact, and, you know, do the data and research to try to make that impact positive. At a Blue Cross plan, you're doing that at a state level. How do you shift care in a state and improve the health outcomes for a state, or multiple states, depending on the blue? And now at Optum, as you said, large healthcare services platform, delivering care directly, but also supporting others deliver care, delivering pharmacy services, delivering technology solutions. What I love about the job is I get to dive in with teams and work on this day in and day out. So, tomorrow I'll be in a clinic in the Massachusetts area. Wednesday, Thursday, I travel a lot. I'll be in Minnesota with some of the teams there, going through the various issues. So, I visit our pharmacies and other places. I got to give one example here. You go see a Genoa pharmacy, which people may not know we do, where they're delivering integrated mental and behavioral health care to people with substance use disorder and severe mental health conditions. And it's just amazing. to see that and to see the pharmacist that's, delivering that care to people and the impact it has. So those are just some of the examples over time.
Excellent. I'd like to dive into a couple of big topics, things that NEJM Catalyst has been publishing a lot about. First is value-based care, value-based payment. You addressed that before. What in the current environment, what is the outlook for value-based care?
And look, I think the outlook is still very positive. So I like to remind people, as you said, I've had a lot of different jobs and I'm getting older. Um, the alternative is fee for service care, which is typically uncoordinated, not as efficient as it needs to be, versus value-based care. Now, to be clear, for us and others, there are times we deliver fee for service care, and that can generate positive outcomes as well. Uh, and in the value-based care construct, if we take, or any other entity, full risk for care for a dual eligible or a Medicare beneficiary or a commercial or Medicaid population, it aligns incentives. That all of our incentives are how do we produce better health outcomes and an exceptional experience at a lower cost. And when we do that, there's evidence from Optum, from CMS, from other areas that costs come down and quality experience can go up. Granted, uh, and this is true in government and at Optum, you've got to decrease the variability and standardize. So as you know, not all CMMI models work. That's the nature of innovation. That's actually not surprising. But then how do you scale the ones that do work? In our system in Optum, we continue to test and learn, and I often talk about cycle time internally. So how do we improve the care quicker for people, whether it's in the home or a clinic or an ambulatory surgical center? Then, how do we measure the results and continue to test and improve? So look, I'm bullish. We are bullish about the future of value-based care in the U.S. and the impact it can have. And it's been bipartisan support over time, and we hope that continues.
So the other topic to dive into a bit is AI, of course, dominating the conversation. Um, what is Optum's stance right now? Are you diving in, say, with ambient listening for clinical notes, or is it more of wait and see?
Yeah, we are definitely diving in. And look, I'm a learner too. My son is doing an AI fellowship this summer, and I barely understand it. So I attend the sessions. I learn as well along with the teams. We've got over 1,000 use cases, and I'd say now we're really moving even more so to how we scale these across our platform. And let me give you some examples, and I'll again start with the patient story in the clinical arena. My first week as an attending at Children's Hospital of Philadelphia, um, I had a patient with a very rare disease. It bounced around America for years. Shows up with a 500-page chart. Um, Takes me a very long time to go through that chart. I eventually, many, many hours later, get to page 282, where I'm like, oh my gosh, I think this child has a metabolic disorder. We end up making the diagnosis. The family is thankful for that. But now you can have AI scan a chart like that, tee up options to a clinician or a physician, help that clinician or physician provide care. Similar for, what's the next best action? What's the lab that is needed? And we're doing that in the clinical arena. Once again, though, the physician or clinician making the final decision, but helping them with their management. Other area I'd call out is experience. I said it earlier, so I won't drain all the examples, but how to use AI and data to both help the consumer and also, by the way, we we answer hundreds of millions of calls every year. How do you use digital to make some of those calls just go away because you've solved the consumer's need? And then when the calls come in, which is this is a real example that we're doing, how do you tee up to that customer service rep? Oh, we see a prior authorization, we see this problem, help that consumer representative who's working hard every day to solve people's problems, solve it faster, better, easier. And then the last area I'd call out is in the sort of what I'll call the sort of administrative efficiency, which includes prior authorization and other things. How do we use that to make it much more efficient? So, real example in the RX space where we had prior authorizations, it would take 8 hours to sometimes days or weeks, connecting clinical data to using AI. You could get approvals to prior authorization. We actually got the median time down across multiple health systems that were partnering with us to less than 10 seconds. That benefits everybody because the doctor knows the patient's medicine's covered, the patient knows, and the next order is we tell the patient the price. Everybody is transparent around what's in the system. So I get excited about this last use case because I love this one. In specialty medicine, we used AI to find ways to lower the out-of-pocket costs for medicines, whether they be coupons or programs from us or others. Specialty medicine, median copay, so think cancer, other specialty conditions, $5. 88% reduction in the cancer arena for copays. And then I got an email, real story, from a person served by Optum who said, I'm a farmer. I'm in my 60s. I have cancer. I was going on and off my medicine because I couldn't afford it. And I wasn't telling my wife. And now I pay $5 and I'm on my cancer medicine and I'm doing better. And it just, that's impact from the population level or to the individual level. So those are some of the examples I'd share.
So that's a lot of the upsides of AI, and those are great examples. I guess the other side of AI that we have been publishing about at NEJM Catalyst is, concerns about trust and transparency and bias. And let me ask about clinician trust in particular. Of course, there's long concerns about clinicians being replaced by AI. That's a simplification, but how do you address clinician concerns? Because Optum has a lot of clinicians.
Yeah, I think the major issue, and you hit on it, is transparency and building trust. So if you feed up options or suggestions or other things to a clinician, they generally if it makes their life easier, better, et cetera, and they understand and it's transparent, I think it's beneficial. On the flip, if you build a system that, they feel like they're not able to exercise their clinical judgment or, I think then we don't do that, but that would create challenges. So I think it really gets back to transparency and building that trust. And the last thing I'd say is we co-design these with our physicians and clinicians. So I actually have a call later today on that, where the physicians and the clinicians, nurses, nurse practitioners, others are shaping the data and the ecosystem, and that builds trust because they've helped build it.
Very good. So clinician burnout remains a top concern. We talked about this in the past, and it remains a top concern. It never goes away. What can big healthcare organizations do beyond platitudes to really meaningfully improve clinician well-being and professional satisfaction?
Yeah, so I think we have to focus on physician and clinician burnout and support them. So I'll give you a stat that may surprise you. Burnout is obviously too high nationally, as you know, and we have talked about. The physician burnout rate among Optum's doctors is about 34% below the industry average. So, you might say, why is that? So it's probably multifactorial, but let me give you some examples. Ambient listening technology, which you asked about earlier, we are using and deploying, and we're looking at saving providers about 20% of time per visit. So it's helping them, it's supporting them. On the workflows, how do we make it faster? How do we make it easier? How do we tee up options for them? On the data piece on population health, how do we show them, hey, here's your 50 diabetics who might need help, people with diabetes. Here's your 20 people who are on treatment for depression, maybe check in with them, maybe digitally via the app, maybe, engage those patients, maybe bring some of them back in. How do we make the system better and easier for those physicians and clinicians? And as I said, we do that directly for those, in Optum Health, but we also do it with health systems, with hospitals, with, others across the country. So major issue, as you know, there's not going to be one silver bullet, if you will. But I think if we focus on how to make the system better, how do we provide physicians and clinicians the right information at the right time? And then the other area I'd call out, which prior authorization is a pain point. So how do you make it easier? How do you make it automated? How do you make it fast? How do you make it clear? So that's the kind of work that we're doing. How do you make it real time? So
Hmm.
that's the kind of work we're doing day in and day out.
Yeah, maybe prior auth is something that Optum can really, in particular, make headway on. Um, so next question about your physician practices. And Optum has a ton. I'm not sure how many. Please tell me. You're you're very large, geographically dispersed. Um, how do you create a shared mission and culture, or do you put it another way? Like, how much emphasis do you put on that?
It's a great question. A lot of emphasis, and I think we'll continue to improve in this area. So, is at Optum, and this has been true for different roles over time. How do you align to a mission and vision, which we do at the Optum level, and then we do in the various businesses as well? And then how do you set strategic initiatives with the teams? How do you then measure results? And how do you continue to improve? So those are kind of the core, based on the data and evidence. Those are the core tenets that we're
Hmm.
trying to implement. And then, you asked, we've got care delivery organizations across the country, clinics, home care, et cetera. We have some work to do to standardize both the culture, but also the processes and the outcomes. So we have some regions that are very high performing and some that are less high performing, as an example. Okay, how do you bring those regions that are, and often those regions may be newer, maybe they're not as far along, but how do you standardize the model and sort of systematize the model? So we're doing work on that right now. The other aspect I call about is integrating the various parts. So, how do you integrate mental and behavioral? How do you integrate pharmacy? How do you bring, if there's a Mrs. Rodriguez that we're caring for and she's a 90-year-old with multiple chronic conditions, she just wants us to care for her. Her physical, mental, social, pharmacy needs. She just wants them taken care of. That's what her and her family want. So how do you deliver on that? And then the last thing I do a lot of is I get to the front line. So, I'm going to be in a clinic tomorrow and I'm going to talk to the teams and ask how we can help and, what's going right, but maybe more importantly, what we do better to support them. So, I learned that from mentors very early on in my career, and it's still applicable today. So those are some of the things that we're trying to do.
How many different physician practices are in Optum Health now, and how many physicians overall or clinicians, however you
Yeah,
want to count it?
yeah. So we have there are there's about 40 care delivery organizations, specifically 43 over time, but we've organized those into four regions in Optum Health.
Hmm.
Employed physicians, this is actually an important question. Employed is right around 10,000, so it's not the number that often gets quoted. Um, Contracted, so when you add in contracted IPAs, doctors that, by the way, have chosen to work with us, you
Hmm.
get closer to that 90,000 number that often gets quoted. But I actually think it's an important distinction. The employed number is smaller. Contracted is a larger chunk, and those contracted physicians are choosing to work with us. So that means we're providing something that they value, and we appreciate that partnership.
Well, closing question. You just touched on mental and behavioral health services. You and I have talked in the past about the importance of that. What is Optum? What is your focus these days? There have been reports of delays in mental health claim reimbursements tied to prepay review. How is Optum balancing program integrity with timely access to mental and behavioral health services?
Yeah, look, I'm so glad you asked this question. As you touched on, I'm passionate about it. Um, it certainly has touched our family's life, and by the way, based on the statistics, in some ways, touched most people in America, whether directly or through a loved one. And what we need to provide is access, better health outcomes, and integration. So, give you some examples there. And actually, we pulled some of this data in preparation because I wanted to see how far we come. That business used to, I guess it reports to me again, but I used to work directly with it when I first came into Optum. And we had a goal to get access on average less than 7 days. I'm happy to report it's right at 5 days right now. So that's positive. Now, is there someone in America seeking care right now that's having challenges? I guarantee you there is. That's the nature of large systems, and we need to work that, whatever your condition is, we can provide you access, and we've got a large network to do that. So that's sort of access, and we'll continue to focus on that.
Mhm.
Um, the next thing and this is a great example because I've had a lot of different jobs. I worked on collaborative care when I was at CMS. So NIH study that collaborative care, psychiatrists and mental health professionals supporting primary care generated better outcomes. We did a CMMI Innovation Center model, showed better health outcomes, lower cost. We then scaled it in Medicare, working with Patrick Kennedy and others to give credit where credit's due. So worked with an ecosystem of people. So made it a payment model in Medicare, which still exists today. Now at Optum, we're providing collaborative care at scale. And real example of a patient that got sent to me the other day, 70-year-old in one of our risk-based models in Medicare, uh, husband passes away. She had underlying depression, starts, that exacerbates, as you can imagine it could. Got her into care, and the primary care doctor did a collaborative care consult with the psychiatrist, adjust her medicines. She's doing better. She doesn't get hospitalized. She feels better. She's functioning better. That's the goal.
Mhm.
So just a tangible example from the macro policy to the patient. And, we're scaling that collaborative care model across the country, across our clinics and homes. So if somebody has a mental and behavioral health condition, we can provide that care, measure that care, and improve the outcomes. So, look, it's a great question to end on. Just in closing, I love serving in this role. We've got a huge responsibility to provide care to millions and millions of people across the country and services. That's what keeps me going and energized. And we've got an amazing team. And I think you'll see us even more figuring out how we partner across the system to drive the changes we all want: better health outcomes, better experience, and a lower cost for our U.S. health system. So I appreciate you having me. I've always enjoyed it. I still read New England Journal, by the way. I just really appreciate the dialogue, and hopefully it was helpful.
Well, thank you, Patrick. And I like how you summarized it. Optum has such breadth, huge responsibility, as you said, huge opportunity to change healthcare. So thank you for your time. And as always, great to chat.
Thank you. Appreciate it.